Greetings and welcome to the session on pharmaceutical care. I'm going to talk about what pharmaceutical care is, what the components are, how we should be providing pharmaceutical care to patients, what are the modalities, and then trying to just better understand what the term itself really means. Pharmacy practice has evolved since the 1850s, all the way until the 21st century. Between 1850 to 1900, pharmacists' primary responsibilities were stocking in the pharmacies, providing medications to patients. During this period, they actually ended up talking to patients and giving them advice. So there was much more of a congenial relationship between patients and provider. During the years of 1900 to 1960, the American Pharmaceutical Association came in and said that the pharmacist's role was more to lick and stick and pour. And so pharmacists' roles were relegated primarily to filling and dispensing of medications as opposed to actually communicating with patients. Approximately around the late 1950s, this sort of thought process started to change, and pharmacists started to go back to the earlier version where they would like to talk to patients and they would like to provide information on what the medications were, what they were for, how they were supposed to take them, if there would be any adverse drug events, and so on and so forth. So pharmacists started to see themselves more as clinical as opposed to just dispensers of medication. As this thought process evolved in the late 1950s, the American Pharmacists Association amended the role of pharmacists in their pharmacy practice statement to include or incorporate the clinical aspects of this role. As the role started to evolve towards the 1990s, there came a concept in 1990s by Hepler and Strand called pharmaceutical care. And pharmaceutical care since the 1990s has continued to evolve and manifest in many different forms. So you can see different terms like DUR, which means drug utilization review. Drug utilization review can be prospective, so at the time that the patient fills their medication or prescription. It can also be retrospective, where pharmacists can look back on patient records at the databases and then evaluate them for drug utilization. There can also be something known as medication therapy management, which came about as a law in the United States. And this actually requires the pharmacist to counsel patients who have more than a certain limit or number of medications that they're taking so that they can provide more appropriate care and they can guide the patients towards better care, thereby optimizing their outcomes. So the whole premise of pharmaceutical care really evolves around optimizing therapeutic outcomes. So this talk is primarily going to feature on what this optimizing of outcomes really means. Pharmaceutical care, like I said before, the term came about in 1990s by Hepler and Strand, and it is defined as the responsible provision of drug therapy towards improving patients' quality of life and medication outcomes. Such outcomes are, so number one outcome would be the curing of a disease. Ideally, pharmaceutical care and pharmaceutical treatments were designed and improved over the years, keeping in mind that some of the diseases had a definite beginning and a definite ending, which is true for most infectious diseases, where you can see that there's an infection, the patient takes some sort of antimicrobial, and then they feel better and the infection is alleviated. The other outcome that we're looking for with pharmaceutical care is alleviating or reducing patient symptoms. So, when a patient experiences discomfort, when they experience a certain kind of symptom, what we're looking through with the pharmaceutical care, with the medications that we're providing them as pharmacists, is to help reduce those symptoms. If they could potentially disappear, that would be very nice. That would be a very wonderful goal to achieve. But at the very least, we want to help them reduce their suffering.